This essay example, as well as thousands of others, is available in text format on our website for free and without registration. Simply Google Ivy Panda Free Essays.
Introduction. Every person has some form of attributes, which are weaknesses and strengths. A person's weaknesses and strengths can influence that person. As a nurse practitioner student, I must look for my weaknesses and strengths. As a student nurse practitioner, I rate myself as average regarding my confidence level. In this regard, the paper addresses my weaknesses and strengths and 3 objectives and goals for my practicum experience. Strengths. Moreover, I tend to have various strengths in my area of expertise. The first significant skill that I possess is practical communication skills. My exceptional strength is conversing effectively with my colleagues, patients, and their families. According to Seidel et al., the establishment of optimistic patient affiliation begins with a conversation built on comfort, courtesy, confirmation, and connection. Secondly, I possess professional skills characterized by communicating professionally or collegially, accepting constructive feedback positively, and talking and dressing professionally. I always urge my preceptor to correct me in case I need to correct a mistake during clinical rotations. Weaknesses. On the other hand, my main weakness is that I usually miss my differential diagnosis. Differential diagnosis is achieved by getting thorough, objective, and subjective data focused on detailed patient history and focused examination. What I fear most is prescribing medication to a pediatrician population. To become an excellent nurse practitioner, my goal is to collaborate with my supervising doctor whenever I am double-minded about prescribing medication and downloading helpful apps like Hippocrates. Lastly, I have a great weakness. I lack the courage to say no either to the management team or the supervising physician. I find it hard to say no, even to offers out of our permissible scope of practice. However, I am looking forward to seeking advice from an alternative physician so that I can turn down some offers. Clinical skills. The most common clinical skills I possess are suturing and cervical dilation. During clinical rotations, I have explored stitching. However, I tend to feel that I am required to work on my tying techniques. I already informed my preceptor that I would want some assistance if we receive a patient who requires suturing. Further, I have been applying the tissue model to gain more suturing skills and experience. Similarly, I have completed several vaginal examinations on good visits during clinical rotations. However, the biggest challenge has been checking cervical dilation in pregnant women. My preceptor is understanding and has permitted me to carry out cervical dilation while supervising me. Every time an expectant lady visits the clinic, my physician and I would seek her permission to check cervical dilation. My 3 primary SMART objectives include: first, I will articulate a diagnosis for each patient as well as seek a quick response from the preceptor. Secondly, I will ensure that I will consider the preceptor's responses next time while developing my diagnosis. Lastly, I require minimum to 0 support by the end of the semester. Further, my objectives will be measured by the compliments I will get from my preceptors and other colleagues. Conclusion. In conclusion, all people have different weaknesses and strengths, and I am no exception as a student nurse practitioner. Some of my strengths include excellent communication skills and professional skills. On the other hand, my weaknesses include problems in medication prescribing and differential services. Other skills include clinical skills such as suturing and cervical dilation. If you want to find more works like this essay on clinical skills self-assessment, head over to ivypanda.com. It has a collection of free samples with thousands of submissions covering virtually all academic subjects. No registration required to access it.